Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So if I asked all of our listeners and made a big test, you could win $1,000 if you knew what a nephrologist was. I'll bet without looking it up you wouldn't. But it's great to have someone in that medical specialty because we're going to learn so much you'll know the next time you can ask your friends. Do you know what a nephrologist is? So I'm going to introduce you to Dr. Carlos Duran, and he is a nephrologist here in South Florida. It's a couple of different locations. So welcome to our show, Dr. Duran.
Thank you very much. Thank you for having me.
The first thing I said to him is something about diabetes, and he said, well, and also hypertension. I said, what? Why don't you explain, maybe you just explain about a nephrologist and then what you would do if a new patient comes in.
No, absolutely. And even before we get there, just with the point that you just mentioned, nephrology, you're absolutely right. You're so right that most of the time I say kidney doctor because nobody knows what a nephrologist is. But yeah, going back to the point that you just mentioned. So basically, when we talk about kidneys, a lot of people always think diabetes. And that's actually right. That's the number one cause of kidney problems in the United States. But the second one is actually high blood pressure, which is a very common problem also like in the in our population and in this area and any area, basically.
But why is that true? Why don't you go through the whole thing?
Yeah.
The kidneys, of course, I guess we understand that we urinate, right?
Exactly.
That'll
correct.
tell us the rest of the story.
Exactly, correct. Well, kidneys, basically they're a filter, right? So they clean the poison, they take away all the bad stuff, and it basically keep the good stuff in our body because we need that, obviously. But high blood pressure is the kidneys, first of all, regulate also the blood pressure. For example, like controlling the sodium, okay? Like people with advanced kidney disease, they tend to retain sodium, and that high sodium makes the blood pressure go up. High blood pressure can eventually, it's a progression. It takes time, but eventually can affect your kidney. So,
okay, but let's just go through one thing. I know that we actually have a wonderful organization who is a kidney dialysis organization. And we're very pleased with them. And I've gone in there and I've kind of seen it. I'll just tell everybody, it's United Dialysis over there in Atlantic Boulevard, I guess it is. And I have had the pleasure of just touring it. But once I got in there, it was a little bit scary. I didn't quite understand why all these people were sitting there with tubes going into their veins, right?
Well, you're right. That can be very scary. And actually, when we see our patients in the office, the first thing they ask us, am I going to be on dialysis? Which is that basically what you're talking about, patients on dialysis. So that is basically the end. If, we as nephrologists, our work is try to prevent you from getting there. We do everything we can with you, with the family. This is multidisciplinary, and everybody needs to be involved with this because it takes a lot. It takes a lot. It's not as easy as just seeing your nephrologist every 3 months, and it's not that easy. You have to make changes with your diet, with your lifestyle. So many things need to change. But you're right. It is scary. It can be scary. It's a complete change in your lifestyle. Okay. Once you start dialysis, that's basically at the end where your kidneys are not working enough. Basically, you have a 5-10% kidney function, and basically you need a machine to do the work of the kidneys for you.
Well, but the beautiful part now is that it's more common for people to get kidney replacements.
Correct. So the first thing, when we evaluate our patients, right, we tell them there are different stages of kidney disease. There are basically 5 stages. So when we see them, we make sure, and I make sure, my main purpose here is to make sure my patients understand what's going on. So the way I see it is the more you know, the more you can do about it. So we explain to them, there are 5 stages, which stage are you? And the last stage, which is stage 5, and that's when we talk about dialysis, that all we do is try to prevent you from getting there.
Okay, but let's go way back. People, I know that everyone talks, especially here in South Florida, about making sure you're well hydrated.
Correct.
What does that have to do with your profession?
Well, I'll tell you this. Absolutely. So that's mostly like in our inpatient setting in the hospital, we see a lot of patients that they are dehydrated for many other reasons. It could be something as simple as having diarrhea. It could be something as simple as they haven't been eating for whatever reason. So dehydration is usually like a source of of an acute kidney injury, which is basically you've been doing fine, and then you have this episode, which could be dehydration, that actually make your kidneys function to slow down. So those patients, they improve, you give them fluids. Sometimes we have to give IV fluids. If they're, for example, like having nausea, vomiting, you give them IV fluids until they are able to tolerate the oral. And then after that, then, you monitor the kidney function. So hydration is very important. Not only that, if you also have, let's say, kidney stones. If you have kidney stone, you're supposed to be very well hydrated, right? So you can flush those kidneys and, that you're incoming, basically.
Oh, okay. Well, it's a very big subject, and I think that this all starts with your general practitioner, doesn't it? The doctor.
Correct.
And then he performs a lot of tests.
Correct.
And what is he going to find, which he will then recommend a nephrologist?
Yeah, that's a very good question. So usually this is the way it works. So usually your primary physician, right, when they evaluate you, when they see you either as a first time they're seeing you, when they're doing their physical, or even as a follow-up, they usually, as I said, there are 5 stages. So they usually manage stage 1 and stage 2. And by that, I mean, like, let's say usually stage 2 is when you have 61% of kidney function or more, okay? When you reach that 60% or less, basically 59, that's when you are stage 3, okay? And that's usually when the nephrologist should get involved. Many times it's not because the primary is doing anything wrong. Many times it's because we want to have, first of all, a second set of eyes on top of you, making sure that we don't let this advance and get any worse. But also, sometimes you have to go through the medications, make sure everything's been adjusted for your kidney function. So basically, the primary it will be the first one seeing all these things that as they progress, and if they do, as I said, usually stage 3, that's when we should get involved.
Okay, there's a lot of good information. Let me just tell our listeners who you are listening to, Dr. Carlos Duran, and he is a nephrologist. He practices at Broward Health North and Broward Health Imperial Point, and in Delray Beach, and at the hospital in Boca Raton. So if you're interested, normally your doctor would refer you to a nephrologist, but sometimes you're going to a nephrologist and you don't like him. Well, I can assure you from the short time that I have met Dr. Duran, you would like him.
Thank you very much.
So let me give you a phone number. If you wanted to call him directly, you would call 954-463-0112. And, don't be afraid of this. We've talked about second opinions before, and you need to get a second opinion. In fact, I'm going to write for one of the doctors that advertise in Boomer Times. I'm writing a story now about second opinions. I think it's extremely important. But let's go back then to urinary functions. It's really the bladder. So when someone is diabetic, they say number 1, that's something that they're born with this. They can't do anything about that, can they?
Type 1 diabetes?
Yes. What did I say?
Most of the time they're born with it, yes. Yes, type 1 diabetes, yeah. Usually type 2 diabetes is the one we see the most in our practice, right? Which is the person that, they're usually in their 40s, 50s. They might be obese. They may have, high cholesterol. And now they're starting to see that the glucose, the blood sugar, is starting to run a little bit on the high side. And that will be type 2 diabetes, yes.
So you're nice, slim, and trim. Do you practice
I try to stay that way.
You practice this because you just said that. It's very important to exercise and to watch your weight. Now, it doesn't necessarily mean that high blood pressure won't happen, because sometimes that's heredity, isn't it?
Correct. That is correct. But the thing is, many times, once again, if nobody tells us, we don't know. Some patients, they feel they're doing something wrong. They actually don't do anything wrong. It's just they don't know. So, it's about information. It's about getting the right people to tell you the right things. So, for example, like something as if you have a high sodium diet, that will make your blood pressure go up, okay? Usually what happens is you have this high sodium diet, and the body to counter that, it makes you retain a little bit of water. That's why the next day after you go out and eat Chinese food, you say, you know what, I'm a little bit bloated. My legs are a little bit swollen, even under my eyes. Well, that's your body retaining water so he can dilute that extra sodium. And you know what? That translates to high blood pressure, especially if you have kidney problems, especially if you have heart problems. So that's why, and sometimes, it's not the patient doing anything wrong. It's just like you don't know.
Right. And how much salt should one have?
Yes. So we usually say on an average, we talk about like a 2,000 milligrams diet during the day. We've seen that actually that should be okay. But once again, this should be individualized. Everybody's different. When we talk about like salt restriction with so many of our dialysis, even kidney problems, chronic kidney disease patients are, even patients with CHF, congestive heart failure, sometimes 1 milligram, 1.5 grams might be too much for them. So it varies patient by patient. So I will say, talk to your primary, address this, and see, what he recommends. But on general, we talk about like 2,000 milligrams or less.
What I've started doing was what it really is I look at the calories. Now packaging has to have calories. And recently there are restaurants that are putting
Correct.
how many calories, and they don't say how much salt. But
Correct.
The reason things taste so good is they are loaded with salt.
Correct.
And so it's really important. So I don't eat out that much for that very reason, because of everyone puts so much salt in there.
It gives better flavor, and also it's a preservative. So that's, in many cases, that's what happened. And then you'll be surprised how quickly you can get to those 2,000s. Even frozen food, if you've seen it, if you see the bag, if you read it, they may have 600 milligrams, 700 just in one meal. So it's so easy to get to those 2,000s.
No, you're absolutely right. That's what I was just going to share that with you, that we were out. I just came back from being out of town, and you're faced with, going to the airport and you're looking at things. Do you know that hamburgers now they're being forced to put it, that there was something that normally you would eat a hamburger, you would eat something, 1,200, 1,500 calories? It doesn't say how much salt, but you can imagine how much salt goes in there.
It has plenty.
And so I think what we have to start doing, though, is watching our children.
Correct.
Because that's where the diabetes is going to start, isn't it, if you don't protect them?
Well, yeah. And here's the thing. We live in such a fast-paced lifestyle now, that everybody works, everybody's outside, the kids, the easy way is to stop at any McDonald's or any fast food in general and just buying, this fast food for our kid. But the thing is, we go, this is what they're seeing. So they are used now to be eating out, having not healthy food. So eventually this is going to be a problem. So this is something, as you're mentioning, Anita, this is something we need to address when they're kids, have, more fruit, more vegetable, more fresh food. So we don't run into this, later on.
Yeah, this is a very, very good discussion, because salt, I'm glad that you brought up the salt and then you brought up the hypertension. That I did not equate before you came here. I did not equate. And you said it was the second most important thing.
Correct.
That high blood pressure. So how is one going to reduce their blood pressure?
Well, once again, there are many ways for us to address this. But first of all, high blood pressure is related to too many things. And some people don't understand the real,
the reason why people have this.
Exactly.
Right?
But I'll tell you this, many times even we physicians are not able to pinpoint exactly why you have high blood pressure. Even we can do many studies, we can do this, we can do that, and sometimes very hard. So we usually start with lifestyle, as we talked before, eating healthy, having the right food, that pyramid that we keep talking about, fruit, vegetables, that's something that is there for a reason, right? So that's something we should definitely follow. But this high blood pressure thing, it is a problem, not only here in the United States, but in many other countries also. We see more obesity now. Obesity by itself can also give you high blood pressure, what we eat, and what we do. So there's so many components of this.
Well, that's really interesting that you've come and talked to us about this, because I did not put that into where people are getting diabetes. That was that was like way down, when someone comes in, they have all sorts of other things they do. So let's get back, though, to actually diabetes. Tell us what that really is.
Yeah. Well, diabetes by itself is basically having a high sugar, in your blood work. When you're primary or you're in your primary care physician, they do blood work. They found that you have either pre-diabetic or you're diabetic, right? So that has to do basically with your blood, with your fasting blood sugar, right, levels. I won't go into specific regarding that. That will be your endocrinologist and that will be your primary care physician. But basically, they can find that in different ways. As I said, they usually can see that in a fasting blood sample. And they can also see there's a new, it's not a new study. It's been there for some time. But we're now implementing it more. It's called the A1C. So that when that A1C is more than 5.7, that's when your primary or your endocrinologist will say, well, you know what, you're at risk for diabetes. So initially, that's the thing about, preventive medicine. You don't need to wait for you to have full-blown diabetes to do something about it. You should do something about it when you're not diabetes yet, right? So you can start doing your lifestyle changes, losing weight, exercising, doing all those things so you don't get to be a diabetic. Because actually, diabetic, when somebody's usually diagnosed with diabetes, you've already been diabetic for 7-8 years. So it doesn't happen from one night to the other, yesterday I didn't know, today I'm diabetic. It usually doesn't happen that way, especially diabetes type 2. Usually that progresses with time. So
how would one know that they have diabetes? Let's say they haven't gone to their doctor. What are
correct.
the certain symptoms?
Well, one of the few things, besides lab work, because for that you need somebody to order that and you need somebody to tell you the results. So basically at home, some of the things you can see, you become very thirsty. Okay, that's one of the things that, make you think about diabetes. Also, not by itself, but for example, thirsty, if you start urinating more than usual. Why? Because usually that high blood sugar makes you pee more. And when you pee more, that's where you have this, we call it polyuria, but that's the medical term, which is basically peeing too much more than usual. So, and the other thing is you're always hungry. You're always feeling like you need to eat. And those are usually the three things we see with, when we're starting to have diabetes.
Of course. Well, that mixes up people who are just overweight and want to eat compared to
correct.
Being really hungry, right?
Exactly.
And also thirsty. And of course, now with the summer, people should be drinking
now during summertime, it's very important, for us to be hydrated. And, and once again, I see this all the time in the office. You tell somebody, are you drinking enough fluids? Because you know what? The labs, they look like you might be a little bit dehydrated. And they said, I'm drinking plenty. But plenty, it varies by person. So you'll be surprised how many people I see in the office and they say, I'm drinking enough. And when you ask them, they're barely not drinking, definitely not enough. So this is something that, once again, you need to talk to your primary, to talk to the physician. So because it varies also what other conditions you might have. Some people can drink as much water as they would like to because they have other issues, especially, heart failure or something like that. So they may have some fluid restrictions. But in general, we usually say to drink approximately 1.5 to 2 liters of water a day.
Okay. Everyone, I know you're enjoying this show because you're learning as much as I am. And as a gerontologist, I know a lot of things, but love having a nephrologist on my show, Dr. Carlos Duran. And he is here in South Florida. And if you want to get in touch with him, you can call him at 954-463-0112. And if you don't, if you don't have anything like this, and we hope you don't, just do what you're doing. But if you do, you have to really question your physician and all the symptoms that Dr. Duran said, figure out what is that. So I'm glad you brought up the Chinese food because that is absolutely one of my most favorite foods. Mm-hmm. But I've tried now to tell people when serving people, don't put any sauce on it. Just the vegetables should be just fresh. But, it doesn't taste the same.
Exactly.
It's what you said.
That's the thing. It tastes so good, and once again, also at the end of the day, it's also about portions. You don't want to overdo it. So also we understand, we physicians, we're humans. We also, we also do things that we know that we should have that extra portion of cake. We shouldn't have this or that. But you know what? At the end of the day, it's about portions. Like you need to be true to yourself. You know that you have kidney issues, you have heart problems, you have high blood pressure. Don't overdo it. If you're going to have it because you feel like it and you want to do it, you know what? Then be smart about it. Have a small portion. Don't add extra soy sauce. It already has enough salt on it for you to be adding extra soy sauce. So those small things that you can do, it might make a difference later on.
And let me give you another example. I just recently came back from a trip up north, and I went with my cousin also. And so what we started doing was just sharing. We shared an appetizer, we shared a salad, and we shared the entree. It was so much food, and it was plenty.
Well, yeah.
And so that's, I think, another thing, what you were just saying. Don't eat too much because, if you are having some salt, at least it's cutting it half, right?
Correct. Well, that's the thing in the United States. We have plenty of food. So even when you go out, it's funny. Like when you go out, they said, do you want to add for 1 cent an extra large Coke instead of a small Coke for 1 cent. So those things, and you said, yeah, sure, I'm getting a bargain here for 1 cent. I'm gonna make a, you know what? So those are the small things that make things worse eventually. Once again, portions are very important. Not only what we eat, but also the amount of what we eat.
All right. Now, I'm not a smoker, and I have to assume you're not. But
I'm not. Yeah.
What effect does smoking have on the kidneys?
So smoking, first of all, it can affect any organ, right, in different ways. It can affect not directly the kidneys, but indirectly it can affect them in different ways. As I said, for example, it can cause like what we call like a peripheral vascular disease. Basically, the vessels that become more stiff. It can cause sclerosis, which is basically like plaques in your vessels, so they don't relax as well. You can get high blood pressure. So not only affect the lungs, because we always think about smoking. No, that smoking only affects the lung. No, actually, it can affect any organ. Not only put you at risk for cancer, it also put you at risk for many other issues. But yeah, high blood pressure, and as I said, problem with your vessels eventually can be, developed because of a smoking habit.
Right, and there are people who smoke, and it's amazing. They just can't somehow. Where they say you can't, it's whatever their problem is.
Well, smoking, it's very hard. It's very hard to stop smoking. That's why you shouldn't start. But if you did already, right, that's nothing, you already did. So it's never too late to stop smoking, right? Some people say, well, I've been smoking for 30 years and I'm fine. Well, you've been lucky then for those 30 years, but you don't want to keep risking your health, right? So it's never too late. Even if you've been smoking for 5 years, 5 days, 30 years, there are ways to try to stop the smoking. There are medications out there. There are things that can be done. There are there's actually sometimes even a psychologist should be involved. Well, you need to do what you need to do, because not only smoking affects you, but also secondhand can affect your family, can affect, people you love. So not only affect you, it can affect you in so many ways. And not only that, smoking is so expensive. So I mean,
right.
So that money
it's
can
true.
be used for some other things.
And it's a shame because so many times when you pass places where you see people smoking, they don't look like they have the highest.
Absolutely, and if you see them, they don't look happy. They're in the corner, like I'm sure they will love to stop smoking, right? The only thing is not, and nobody's saying it's easy because it's not easy. Any habit, anything that you've been doing for many years, is very hard to stop doing. But you know what? Some people have, and there are ways to do it, and there are people that will gladly help you stop doing that.
Right, that is true. If they really decide, if they really understood how serious it was. Now, this is the big question: do you have patients in dialysis who smoke?
We do have them. Obviously, we do. We obviously don't encourage that by any means. We always, offer them ways to stop smoking. As I said, there are different ways to do this. This is not a way. This is not like a one thing. This smoking thing, you have to approach this in many ways, right? It's not only that. As I said, you have to talk to them. You have to encourage them. And every time some people fail and they feel like, I will never do it. It's been studies show that actually every time you fail, you're closer to actually doing it.
That's good.
Exactly. So you know what? Even if you try before 10 times and you haven't been able to do it, keep doing it. There's hope.
And have you had successful operations? Do you operate yourself if someone?
No, we don't. We basically we work very closely with vascular surgeons, and with urologists. We like to see like the urologists, they deal with the pipes and the surgeries, and we deal with the kidneys and the function. But no, we don't do surgeries per se.
But do you have patients who have had kidney replacements?
We do. Oh yeah, absolutely. No, that's the first thing, of course. Like, when we get a patient, we evaluate them for the first time, right? Once again, we go back again to that kidney stage of 1 through 5. Why? Because that's what basically we see every day. So once you reach stage 4 and your function is less than 20%, even though you're not on dialysis, we're actually allowed to actually refer you to a transplant center, and that transplant center can be any that you want to approach. We're not affiliated with just one, so you can go to any of them. But the good thing about it is, once again, dialysis is very scary. I understand, of course. But if you reach that 20%, you don't need dialysis yet, right? You might be heading that way. Obviously we'll try and we'll do everything we can to slow that down and you know, as much as we can, obviously. But at least you can get evaluated for a renal transplant. And you know what? I had patients that we started process early on when the function was 20% or so. By the time they were about to get dialysis, because their function now is 5-6%, they get a renal transplant, and they never had to do dialysis. So yeah, this is something that you should talk to your nephrologist. You should talk about, you know, like your primary physician about this as well if you're approaching that stage.
And people obviously can live with one kidney because many of the family members.
That is correct. We do have patients that they have donated their kidneys to a loved one, to a friend of them, and yeah, you can have a normal life with one kidney, absolutely.
But the person who's having the person who is having the kidney problem, they have it in both kidneys. They can't
Correct.
just have
when
one.
you see, and that's a good question, because when we see this patient, they always ask me, is it one kidney or two kidneys? When you see a function, when I tell you, well, when I see you in the office and I say, well, you have 20% kidney function, that's both kidneys. Could one kidney be working 80%? Could the other be working 20%? That we don't know. But the function that we tell you, that's both kidneys together.
I see. Well, Dr. Duran, this has just been extraordinary. I mean, I learned so much. I'm sure our listeners have. Again, I'll put your number down here, 954-463-0112. Thank you for joining us.
Thank you very much, Anita. Thanks for everything you do for our community and for your audience.
You too.
Thank you very much.